So as you guys can see, I did actually record my slideshow on the PowerPoint presentation maker, but it will no longer allow me to have the little, buttons right here that have the volume maker. So I'm just going to do it this way and go through a YouTube video so that you guys can actually see my PowerPoint. So today we're going to be talking about P. aeruginosa, the drug-resistant pathogen. What is P. aeruginosa? It is a rod-like gram-negative pathogen. It is found in many different environments, but it is not part of the normal human microbiome. It can survive through many different environmental conditions. This is due to its ability to mutate and evolve very quickly and easily. This is actually just a picture of the pathogen itself. How do you contract this pathogen? It is typically spread through person-to-person contact. It was first widely known when it was spread from nurse to patient, and then patient back to nurse, then back from that nurse to a different patient. So it can also be contracted when touching surfaces in a hospital. They were also swabbing the tubs, the sinks, and the mops that they were using anywhere that contains a moist environment. It primarily attacks patients who have a weakened immune system, anyone that has cystic fibrosis, cancer, or any very extensive and severe burn wounds. Those people are very susceptible. What can this pathogen cause? It can actually cause a variety of infections such as UTIs, respiratory infections, bacteremia, which is of the blood, pneumonia in the lungs, folliculitis in the skin, and external ear infections. The picture to the right is just showing at the very top a normal hair follicle. On the bottom left, it is an irritated follicle, and on the bottom right, it is a full-blown infected follicle that is very irritated. The signs and symptoms. With wounds, there are typically just green and blue ooze coming from these wounds. Some people actually reported a strange fruit-like smell. I don't know how true that is, but it was reported. And with most other infections, it's the typical fever, chills, inflammation, and swelling. Those symptoms are just typically heightened when compared to a normal infection. This type of infection, those symptoms are just a little bit more severe. On the right, that is the symptoms of pneumonia all over the body, and then on the left, that is bacteremia in the blood. What treats this pathogen? It is typically a combination of antibacterial drugs, and I know it's like a combination of 3 different ones, but obviously that is subject to change on whether the pathogen mutates or evolves. There may be a point at which you have to switch that combination to see what helps that specific strand. If you have the resistant strand, that is where things get a little bit more complicated. You then have to continually change the combination because of the nature of the pathogen to adapt and become resistant to those drugs relatively quickly. You can actually be getting better with the drug combination that you were on, and then you quickly decline due to that pathogen mutating during the treatment course. How can you prevent this pathogen? Always let your nurse know if your bandage looks strange, has any strange coloring, if it's loose or moist. Take a shower after getting into pools or hot tubs, just to wash off any of those pathogens that were floating in the water. Dry your ears after swimming. Like I said earlier, they like to live in moist environments, so clean those ears out with a Q-tip and make sure they're nice and dry. Always wash your hands, especially in a hospital setting. Be much more alert to that, just because it is spread so easily through hospitals. New medical advancements. There aren't many advancements due to the pathogen's evolutionary nature. It changes so fast that just when they think they found something, that strand mutates itself again and they have to start all over. They are constantly working on new ideas. There are actually some vaccines being tested, but none that have been FDA approved yet. This is my Works Cited page. I hope you guys enjoyed this video, and thank you for watching. Bye.